Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Happy Friday, everyone, and the date today is May 1st. We've had a total of 41 cases to date in Missoula. 39 of those cases were identified by testing, and 2 were epi-linked. We have had 40 recoveries and 1 death, and we have no current cases in isolation, but we do continue to follow our remaining close contacts. So far in Missoula County, over 1,930 tests have been completed as of last night. The state of Montana has had a total of 453 cases and has had 16 deaths. So I want to talk a little bit about reopening. There's been some discussion about reopening plans, and I think a lot of people are confused about what's open and whether a closure came from us or if it came from the governor. So let's start off first by talking about what is open, because more businesses are able to open than people actually realize. Today, almost all non-essential businesses can provide in-store service if they have a plan for social distancing and employee health. Restaurants and bars are on schedule to open to dine-in customers on Monday per the governor's directive, provided that they adhere to the requirements in Governor Bullock's plan. The businesses that remain closed until phase 2 are places that cannot provide social distancing or are venues where large numbers of people can gather. Under the governor's directive, gyms, pools, spas, theaters, concert halls, bowling alleys, bingo halls, music halls are all still closed. Under local order, personal care and touch services are also still closed. If you see other businesses or organizations closed, they may have just chosen to delay opening or provide limited services at this time. For those of you who are frustrated about salons, it wasn't an arbitrary call. The decision was made in conjunction with our medical advisor, looking at guidance from places like Johns Hopkins and thinking about how people are exposed to the virus. People get COVID-19 by being in close proximity to someone, and the longer that contact happens, the more likely the virus can spread. We also know that people are contagious in the 48 hours prior to their symptoms showing and during the first part of symptoms. As you heard yesterday, just because we have no active cases right now doesn't mean that there aren't cases that we haven't identified yet and that are still in the virus's 2-week incubation period. Someone could have it, but have not been identified by testing yet. If Missoula can stay at no more active cases for an extended period of time, that is going to be a much better indication of how much virus we actually have in our community. So more on that in a moment. The reason that salons and touch services aren't open comes down to the 6-foot social distancing. These types of services cannot social distance. You can't cut someone's hair from 6 feet away. The nature of these services necessitates close contact, and that's not the same as passing someone in a retail store or a waiter setting plates and glasses on a table. This isn't a matter of extra cleaning, which we super appreciate. It also isn't a matter of being in the salon one client at a time. Stylists simply cannot provide services from 6 feet away. I want to point out that the governor stressed in his directive for all of us to continue to follow social distancing measures. That said, it has been 1 week since the health officer issued the local orders, and as I mentioned a moment ago, the epidemiological guidance says to watch the data in 2-week intervals based on that 2-week incubation period for COVID-19. In this first week, we started at 9 active cases, and we're now down to no active cases. Testing limitations have also remarkably improved, even just since last week. So if this trend holds for the second week of this watch period, we will have a better idea of the presence of how much virus presence we have in our community, and the health officer will reassess the data and potentially revise local orders on May 8th. So I want to talk a little bit about school contact tracing. There's some confusion and misinformation about contact tracing with schools. Our department can and would do contact tracing if a student is diagnosed with COVID-19. However, the way that we would facilitate contact tracing would be different for COVID-19 than how we have handled other outbreaks in the past, such as pertussis. Instead of assigning a public health nurse to go to each school, it would be handled by the infectious disease branch here at the health department, and we'd ask for the school's assistance in getting us the information that we need to help with tracing in a way that protects the student's identity. So please don't think that we won't do contact tracing, but we will use a different approach than what we have done in the past, just due to the larger nature of this. So the last thing I want to talk about is the video that we recorded yesterday for licensed establishments. If you're a restaurant, bar, casino, or other licensed establishment and you have questions about the requirements and the recommendations for reopening, please see the video on my YouTube channel that was live streamed yesterday where Gina Miller, our environmental health supervisor, discusses all of these recommendations and requirements in depth. That's all I have for my daily briefing today. It's a beautiful day here in Missoula. I hope you can get out and get some fresh air and exercise. And I will talk to you all again on Monday. As always, you can subscribe to my YouTube channel at Cindy Farr. That's CindyFarr. Follow us on Facebook at the Missoula City County Health Department. Check out our website at missoula.co/cvirus. And as always, you can schedule a test for COVID-19 through our 258 info number. That's 406-258-INFO or 4636. If you are having any of the symptoms for COVID-19, and remember that those symptoms have been greatly expanded. So people are available to take those calls Monday through Friday. And that's all I have. Have a great weekend. Stay healthy.